Okay, so I'm Baz Kuti. I'm president of Modac US. Here with me today is Levi Bailey, associate vice president of cloud architecture at Humana. And I'm a great honor and great pleasure to introduce Levi and Humana and the work they're doing on digital health and digital platforms for their organization and their partners going forward. So over to you, Levi.
Thanks, Baz. I appreciate it. Yeah, I lead the teams at Humana that does that kind of is responsible to moving us forward from an interoperability perspective as we're kind of trying to transform health insurance as an industry within the U.S. A little bit of background about Humana I think is relevant to contextualize around the problem and what we're trying to solve and the purpose that we kind of align to on a daily basis. For the longest time, Humana has really focused or been an insurance company. And the history of insurance and the health insurance and health application in the U.S. has really been kind of a partnership between providers and health insurers. However, that partnership has strictly been or more aligned to a financial transaction-based solution, meaning that it was fee for service. When a provider would do a service, they charge the health insurers or, made a claim to health insurers, and then we pay that claim based upon the cost that has been assigned or the reimbursement assigned to that particular service. Over time, and in the last 5 years, we've seen really a pivot in the way that we consider how health insurance and how health as a whole within the U.S. can be managed and kind of transitioned to be more cost effective and create better results. The reality is that, I think everyone knows health costs have been on the rise for years and years and years. Humana sees that as a problem, and in particular in our market, when we look at Medicare and Medicaid, which is our primary market, we do have regular, group insurance and other insurance options and products, but our primary insurance market is really the Medicare market, elderly population. And that has a governmental component to it, obviously. It's sponsored by the U.S. government. And when we look at the rising cost and the services being able to be offered, it's just not sustainable in the direction the U.S. was going. And I think there's a demand by the market to see change and to see improvements in outcomes as well as cost in relation to what you can expect with health insurance and health in general, just your health journey. Right. The way that we look to do that is first changing from a fee-for-service mentality, which is, that basic transactional mentality, to more of a value-based market. Meaning, I want to allow providers to get more money when they produce better outcomes, right? Because again, it's a public market. That's the way it works in the U.S. We're not, or a private market. We're not really a public market where, the government just said, this is what you get, and this is what we're going to pay providers, and then you just offer providers. Now, I think there are benefits and negatives to both market types in the sense that within a public market, you have less choices, less options. You're kind of assigned what you want. In a private market, it's opened up to the world, so anybody can create a provider network or whatever they need, and it's all about what what clientele they can attribute to or get to kind of work with them. With a value-based repayment system, it doesn't encourage just doing services to get funds to pay for your things. It encourages the providers to come to outcomes. Basically, the better outcomes that you achieve, the more we reimburse you in what you do. So it's all based upon the patient and based upon seeing that the patient's best interests are kept in mind. Now, when we think of that as an overall strategy, the insurance and the provider integrations had to change. And we had to start thinking more about how do we put the patient at the front of everything that we do, in particular in the way that we consider how we can assist in creating those better outcomes. And what we saw as an opportunity for Humana as a strategic objective was really to say, hey, we've been in health insurance for a very long time, but we don't want to be a health insurer. What we want to be is we want to be a health company with elements of insurance. Okay. So we used to be an insurance company with elements of health. We would do some things from a clinical perspective, but now we are pivoting or have pivoted to a health company with elements of insurance.
That's an interesting transformation journey you're going through. And obviously interoperability is a key part of that journey. So how have you approached this interoperability in your ecosystem today? And what do you think it's going to be, in a few years' time from now?
Yeah, and so first, I think contextualizing the discussion around what we've done there and why interoperability is important. We have a lot of rich data. In the end, claims still come through us. So all that clinical data and EHRs and stuff across the network of providers comes through your payer, ecosystem. And so we feel that interoperability, and where interoperability really plays a role, is the ability to share that data across the different participants to impact that journey as far as how your health outcome will be impacted. Right. So when we look at it, it's going to be baby steps initially. We started the journey, right? We've created, really, there's a couple of different factors that led us to this point where it's really the right time to make this transition in the healthcare ecosystem. One of the things that we did early on when evaluating our approach on how we were going to tackle interoperability and its place within the market was to do, some joint studies with different groups. And one of the joint studies that was done was with, I believe it was the University of Pittsburgh, if I remember correctly. But I'm not, don't quote me on the location or who did it with us, but I do remember the outcomes or the output from that study. So I think that's a place to start with sharing on it.
Yeah.
They did an assessment of waste in healthcare, because really driving cost in healthcare is about how much waste is in healthcare. Like if we have a lot of waste, that accounts for a lot of the expenditure, and therefore if you can limit the waste, you limit the cost. Yeah. And when we looked at it, we attributed almost $900 billion of waste in the U.S. healthcare system. Of that $900 billion of waste, over a third of it was directly related to interoperability, the lack of interoperability. The fact that data was not shared across the efficient way to where it could actually eliminate the need for waste to occur within the healthcare system. For instance, I go to one doctor, I get an MRI or whatever, I get some tests done, and then I go to another doctor and they don't have it and they issue the same test, and then you go get that test again. Like things like that, you think about it, those are a lack of interoperability, the ability to share data across them that leads to redundant services being offered, wastefulness to occur.
Okay.
So when we looked at the market, that driving factor of cost escalation, the fact that people were not happy with the experience, the customer-driven approach. When you think about it, we live in a world of Netflix, of Hulu, of on-demand services, things where we as a consumer expect to be able to get what we want when we want it, right? That is the world we live in. Facebook, like the digital age. The reality is the healthcare market was not digital. It was not even designed to be digital at this point. You don't have access to your data. Others don't have access to your data. You can't create a personalized experience for an individual. That's not the way it was designed. In order to get better outcomes, really healthcare needs to be personalized because it's a personal journey. Everybody's healthcare is different. It's not a ubiquitous thing. It's not global to everyone. Right. As you look at that, that's where competitors started, innovators started coming into the market. Things like the whole Hathaway, Berkshire, and Amazon initiative to change healthcare, right? That was
with JP Morgan as well.
They didn't want that anymore. They saw an opportunity to disrupt the market. And the reality is, for us as an established vendor in the health industry, we are in a prime position to be the primary disruptor because we understand what the journey has to look like to go from A to B. We know what it is and we know what it could be. And we know what it's going to take to make that journey happen for us to be able to achieve the goals of having a digital experience and a truly personalized experience with healthcare.
So we looked at interoperability. If we put the patient first mindset and then we put the systems and the integration to enable that personal medicine or personal healthcare to be possible, required a significant amount of interoperability to be put in place. And then the second area was really the cost opportunity. You said 900 billion, which is a huge number. And then a third of that related to interoperability. And so the justification is there to do it. And the third aspect in your journey around interoperability was really that if we didn't do disruption ourselves, if we didn't disrupt ourselves, then really we could be disrupted by others.
So somebody will disrupt us. You said that the business case is there. I would say the mandate is there to make it change. Like it's beyond that. Like we have to stop escalation of costs. We have to improve outcomes. I mean, if you look at the U.S. healthcare or U.S. population, I think for a first world country, we may have the lowest expected survival or lifespan of the majority of first world countries out there. And some would argue, well, that's directly related to the healthcare system. I think there are multiple factors, obviously. I think U.S. has some of the best healthcare in the world, too. There are certain services and innovations that you can get in the private market that you don't see in other places. The investments are there, things like that allow for health to actually be, improved through those innovations and research. You just look at the whole COVID situation and the amount of investments and change to get something to market as fast as we can. I think it was directly enabled because of a private market and the ability for drug companies to take advantage of that. However, having said all that, you have to understand that costs can't just continue to rise. And the other factors in the way that we live and decisions we make have to come into play as far as our health. But that is a direct implication to how advantageous we take advantage of the healthcare that is here. If costs are expensive, people put off going to the doctor, doing different things, getting procedures done. There's a lot of implications that go on there, right? So when we look at it from that perspective, there becomes a mandate to make a change, to be disrupted, or it's just not sustainable.